Psychosis and schizophrenia are two terms that you may have heard used before. However, while these terms are related, they describe two unique conditions. Psychosis describes when someone has lost touch with reality. It's actually one of several symptoms of schizophrenia, a mental health disorder. However, people can also have psychosis without schizophrenia. Psychosis describes a collection of symptoms that show a loss of touch with reality. Psychosis may be caused by many things, including mental health disorders, substance use, other medical conditions. Schizophrenia is one of several psychotic disorders. These are mental health disorders that include periods of psychosis. In addition to psychosis, schizophrenia may include other symptoms such as disorganized thinking, difficulties in speech and movement, changes in emotional responding. Psychosis is a group of symptoms that indicate a loss of touch with reality. There are two main symptoms of psychosis: hallucinations, delusions. Hallucinations are when someone hears, sees, or feels things that are not occurring outside of their mind. For example, someone experiencing psychosis may hear voices when no one else is around. Delusions are intense false beliefs that are not shared by others. For example, a person experiencing psychosis may believe that others are conspiring to harm them when all available evidence points to the contrary. Schizophrenia is a complex condition, and what exactly causes it is unknown. Experts believe that irregularities with various neurotransmitters, particularly dopamine, are involved. Genetics and various environmental factors also likely play a role. An individual with schizophrenia can experience periods of psychosis. During this time, they may have hallucinations and delusions. Antipsychotic medications are used to treat acute psychotic episodes in people with schizophrenia. Additionally, these medications can also be used as maintenance medications to help prevent symptoms from coming back. A diagnosis of schizophrenia can sometimes follow a psychotic episode. However, schizophrenia has some additional symptoms as well as specific diagnostic criteria. A person can experience psychosis without having schizophrenia or another mental health disorders. Psychosis can occur due to things like substance use, medical conditions, and certain medications. Treatment is most effective when psychosis is identified and treated early. The treatment of psychosis typically includes medications, therapy, family support, social support. Antipsychotic medications can help to reduce the symptoms of psychosis. These medications can be given as either pill or an injection. Therapy for psychosis often consists of cognitive behavioral therapy provided by a mental health professional. It may be provided in an individual or group setting. Cognitive behavioral therapy in this case is specifically tailored to symptoms of psychosis or schizophrenia. Family members are also key in treating psychosis. It's important for them to learn more about psychosis and how to interact effectively and empathetically with their loved one. Someone experiencing psychosis may benefit from social skills training or help with returning to work or school. Schizophrenia is a chronic condition for which there is no cure. As such, treatment focuses on managing symptoms and building coping skills for daily life and functioning. It can include a combination of treatments. Antipsychotic medications can help with the psychotic symptoms of schizophrenia. These include medications to treat acute psychosis, followed by maintenance medications to prevent symptoms from returning. Therapy, which can include cognitive behavioral therapy, is an important part of treatment. A mental health professional can also help a person with schizophrenia develop coping strategies. It's important that family members learn about schizophrenia and how to support their loved one, making sure the loved one is taking medication and Similar to psychosis, people with schizophrenia can benefit from social support services. These services can help with returning to school or work, improving social skills, and coping with stress and everyday challenges. Schizophrenia is also associated with several comorbid conditions. These are conditions that can occur along with schizophrenia and can include depression, anxiety disorders, obsessive-compulsive disorder, substance use disorders, cardiovascular disease, diabetes. Comorbid conditions can have a significant impact on the overall health and well-being of people with schizophrenia. Because of this, management of these conditions is another important aspect of schizophrenia treatment. If you enjoyed this video, subscribe, like, share, and comment.